Hello, everybody. Welcome. My name is Tamsin Rose, and I'm a Senior Fellow for Health at Friends of Europe think tank in Brussels. And I have the privilege of being the moderator for this session, where we're going to be talking about the Let's Talk Prostate Cancer campaign and how we could improve outcomes for people living with and experiencing prostate cancer in Europe. We're going to be running from 1 until 2:30, and we have an amazingly distinguished panel of speakers who are going to share their experience, and you, the participants, will have an opportunity to engage in by sending in questions or comments. This event is being recorded, and it is also being transmitted on social media. And if you'd like to contribute to the conversation on social media, please use the hashtag Let's Talk Prostate Cancer. Now, many of our speakers are engaged in frontline care and are actually calling in today from their hospitals or clinics where they work. So what is particularly unique about this event is we have policymakers who will be looking at the policy framework, and we have frontline clinicians and patients who can share their direct experience. And I have to pass on the apologies of the MEP Sirpa Pietikäinen, who was due to act as one of the hosts, but she's unable to join us today for work reasons, but she spends her best wishes for this event and hopes it goes well. So to give an introduction, I'd now like to pass the floor to Tiemo Wölken, an MEP from the European Parliament and the chair of the Let's Talk Prostate Cancer expert group. Tiemo, the floor is yours.
Thank you very much, Tamsin. I would really like to thank you all for being here today. And as you already said, I am the chair of the Let's Talk Prostate Cancer group in the European Parliament. And it is really great to see how many people are invested and interested in this topic. And I'm also very happy about that today I'm seeing many faces again, so it's good to have a stable group who is pushing or who are pushing for this very important topic. The Let's Talk Prostate Cancer expert group was established in 2019 to raise awareness of the need for action for those affected by prostate cancer across the European Union. And this pan-European expert group brings together representatives from key EU stakeholder organizations in the field of prostate cancer, including Europa Uomo, the European Oncology Nursing Society, the European Cancer Patient Coalition, the European Association of Urology, and the European Association of Urology Nurses, and the Charité University Hospital in Berlin, as well as GP and psychosexual therapists. So in 2020, the Let's Talk Prostate Cancer campaign program reflected the impact of the COVID-19 pandemic on prostate cancer patients and on the health policy agenda. In the European Union, more than 2 million people are living with prostate cancer, which is the most often diagnosed cancer among men. Yet, the condition often does not receive the attention it deserves. On top of the existing issues people affected with prostate cancer face, the COVID-19 pandemic has led to unprecedented disruption of health systems, economies, and everyday life. And it is a particularly worrying time for cancer patients, as the impact of their condition and its treatment means that they are at an increased risk from the pandemic. I'm involved with the Let's Talk Prostate Cancer expert group because I want to help make this serious and life-threatening disease a political priority across Europe. So the upcoming Beating Cancer plan from the European Commission will hopefully give us an opportunity to integrate prostate cancer further in the discussions and make a positive change for all affected. So thank you once again for being here today, and I'm very much looking forward to the discussion.
Thank you very much, Tiemo. And let me now pass the floor to Josas Olekas, another member of the European Parliament and a vice chair of the expert group. Josas.
Thank you, Madam Tamsin. I'm just vice chair. My boss, Tiemo, and I would like to welcome dear colleagues. First of all, I would like to thank everyone for attending this event. I would like to draw your attention to the importance of the Let's Talk Prostate Cancer campaign, which continues to advocate for the EU work together with the member states to make better prostate cancer care reality for all active citizens. Multiple studies provide robust evidence confirming that early detection of prostate cancer saves lives and improves quality of life. We have to face the fact that EU far too long has overlooked prostate cancer. In the previous hour meeting, we discussed about prophylaxis, about early diagnosis, and I think it's very important that the treatment also. Even thought if the EU already provides guidance on screening on the breast, cervical, and colorectal cancer, it is a time for prostate cancer to be added to the list. EU cancer plan should provide funding for the EU-wide awareness raising campaign on prostate cancer and to make data-updated clinical guidance on early detection and diagnosis for prostate cancer. This guidance can be and has to be taken up by EU member states in their national cancer plans. We have to continue our work to include prostate cancer in national cancer plans to display associated mortality and incidents across the countries and to raise awareness of social, economic, ethical, national and regional inequalities. Lastly, coherent transnational research for both prevention and therapeutical can help to boost multidisciplinary cancer research further and stimulate innovation. This mission will also require an increase in the level of financing for basic research, adjusting existing funding mechanisms to boost transnational research, as well as the use of structural funds to support less equipped member states. I am pleased that we have continued our great efforts to fight for the right of our citizens to universal, holistic health care, where no one is left behind and no problem is and will be forgotten. Thank you and have a good discussion today.
Thank you, USS. That's extremely helpful to give us some insight on the values and clear goals of the campaign. And just to let the audience know, you will have an opportunity to ask questions and comments through the Q&A function that you'll find at the bottom of the menu. And we're also going to be launching in a few minutes a poll to ask you some questions. So get ready for the interactive part of our day. Let me now pass the floor to Mr. André Deschamps from Europa Uomo, and he's going to tell us a little bit more about the impact of COVID-19 on people living with and experiencing prostate cancer in Europe. André, the floor is yours.
Good morning. I'm André Deschamps. I'm the chairman of Europa Uomo, which is the Patient Prostate Cancer Coalition in Europe. We represent members in 27 countries in the European region. Personally, I was diagnosed with prostate cancer in an early stage nearly 20 years ago. So I consider myself lucky, as we must realize that more than 50% of prostate cancer patients in Europe are diagnosed in a metastatic phase, too late for long-lasting treatment. The COVID-19 pandemic has a severe impact on those affected by prostate cancer. Not only they are at an increased risk from COVID-19, but the pandemic has severely disrupted the prostate cancer care pathway, which will likely have a negative effect on patient outcomes. Recent studies have shown that 20 to 25% drop in general cancer care diagnosis, with drops up to 50% for those cancers with no symptoms. And unfortunately, as you all may know, prostate cancer is symptomless until it becomes metastatic. Data suggests that older men, and especially those from a Black and minority ethnic background, are more likely to die from COVID-19. And this is exactly the same part of the population that is also likely to be impacted by prostate cancer. Prostate cancer is already responsible for 25% of all new male cancers and 10% of male cancer deaths, accounting for 107,000 deaths across the European member states in 2018. And those men are not old men. 50% of prostate cancer patients are diagnosed before the age of 65, and 75% are diagnosed before the age of 70. Nonetheless, policy attention to prostate cancer care is very low. And as I already told you, prostate cancer is increasingly diagnosed in an advanced metastatic stage. And this is due to the lack of early detection programs. The quality of life of those patients in Europe is, and we published with Europa Uomo recently a EUPROM study, the quality of life is very low. We have the scientific knowledge today to avoid prostate cancer deaths and give the patients a much better quality of life. Let me tell you, it is the duty of policymakers to make that happen and change the healthcare systems. In doing so, we will avoid healthcare inequalities, stigma and health system failures, resulting in suboptimal patients' outcome. The Let's Take Prostate Cancer Expert Group is calling on the European policymakers to make prostate cancer a priority and to work within the European institutions to give the member states the tools, the guidance, and the incentives to ensure that they have the best possible prostate cancer plans for their country, including dissemination and application of the European guidelines. And to make information and data on prostate cancer more accessible, the Let's Talk Prostate Cancer Expert Group has launched last week a new interactive digital atlas providing information on prostate cancer care across Europe, as well as specific information on each EU country and the UK. The link will be provided to you. I encourage you all to look at it with your own eyes. Thank you.
Thank you very much. You've highlighted for us both the very dramatic messages that this is a disease that, because it's largely symptomless, by the time it's been detected, it's at a late stage, and certain proportions of the population are at higher risk with very poor health outcomes and low quality of life. So something that clearly needs to be addressed and given more priority. And it's at this point I'd like to just check your level, the audience, your level of knowledge and understanding about prostate cancer. So we're going to launch a couple of polls, and I'm going to ask you 3 questions. So could you please answer those questions? The first question that we're going to be asking you is, do you personally know anybody who is living with or has had prostate cancer? So I'm going to have the poll open for about 40 seconds and just see. And that you can see that overwhelmingly the number of people have said yes. And now that probably makes sense if you've chosen to join a webinar about prostate cancer. But generally, cancer is very prevalent in our population. So I would think if you asked most people if they thought about their extended network of relatives and friends, workmates and colleagues, you will find that you do know somebody who is living with or who has had prostate cancer. Interestingly, still, 20% of people who have chosen to join this seminar about prostate cancer have chosen to do so because they want to learn more about it, because they don't have direct contact or within their specific personal networks, but are still interested in the topic. And that's very encouraging to see. I think we're going to close this poll now. 80% of you have had contact. You know someone who's living with or has had prostate cancer. So now we're going to test your general knowledge. How much do you know about the European Union? How many men are living with prostate cancer in the EU? And it's a multiple choice. So choose one of these. Do you think it's 1 million? Do you think it's 2 million? Or do you think it's 3 million men who are living with prostate cancer in the EU at the moment? And this is, of course, one where there is a right answer in the sense that there is a number that is the figure at the moment, but it's not the right answer, and that is the figure we want to change, because obviously we'd want to reduce it. So I'll keep this poll open for another 10 seconds and then we'll stop. At the moment, it's more or less evenly split between people who think there are 2 million and people who think there are 3 million. Okay, 3/4 of the audience have voted, so let's close this poll now. And here we can see that the audience have selected 2 million by a very narrow margin, and you are correct. That is the number of people currently living with prostate cancer in the EU. So now let's ask you the third question. Prostate cancer accounts for which percentage of all new male cancers each year? So again, you need to make a choice between whether you think it's 15%, 20%, or 25% of all new male cancers which are diagnosed each year. Bear in mind the messages that we've had earlier about the number of people, because it is symptomless, it is often diagnosed at a metastatic and late stage where we have poor outcomes and quality of life. So this really does matter. I'll leave we've had 2/3 of you have voted so far. I'll leave the poll open for another 5 seconds. So which percentage of all new male cancers each year do you think are prostate cancer? Let's close the poll now. And it seems that over half of you have opted for 25%, which is the correct figure. So it's a very significant proportion of the cancer burden every year. And this is something that obviously means that we can do something about it and needs to get a much stronger focus in the EU's new Beating Cancer Plan and for the Cancer Mission Board. So thank you for participating in those polls. And now we're going to move to a session where I have a panel with 6 different experts who are going to share their perspectives, particularly around the Let's Talk About Prostate Cancer campaign. So let me just introduce all of the panel, and then I'll go through them one by one. We have, and they will unmute themselves and put their cameras on so we can see them. So let's start with Andreas Charalambos, who is the president for the European Oncology Nursing Society. We have Jacqueline Daly, who's the secretary to the board of the European Cancer Patient Coalition and who is the wife of a prostate cancer patient, in addition to her specific role supporting the European Cancer Patient Coalition. We have André Deschamps, the chairman of Europa Uomo, who spoke a few minutes ago. Maria de Santis, the head of the Uro-Oncology section at the Charity Hospital in Berlin, and she only half an hour ago finished her frontline clinic dealing with patients. We have Ortwin Schulte, the health attaché for the permanent representation of Germany to the EU. And we have Jan Willem van der Loo, the scientific and policy officer for DG RTD, that's research and development of the European Commission. And we will also be joined by Philip Reynolds and Mary Rogan, who are in the audience, but who helped contribute as part of members of the expert group. But let me start with you, Andreas. In this panel, we want to explore prostate cancer treatment and care. How do we improve it? What is it from the patient, the policy and healthcare professional perspectives that we could do? So obviously you're from the Nursing Society. Could you give us a short 2-minute intervention, what you think we should be doing about prostate cancer? Andreas, the floor is yours.
Thank you, Tasmin. As the previous speaker said, treating prostate cancer is a very complex and demanding process, and one that calls for a multidisciplinary team approach, which is comprised of health professionals from different disciplines, including specialist nurses. These specialist nurses work as part of this multidisciplinary team and in partnership with the patients to plan, deliver, and evaluate individualized care, which is focused on facilitating health and enhancing well-being. Specialist nurses in this context bring qualities such as active as key workers across the patient's whole pathway, bring advanced communication, advocacy skills, but also leadership, to just mention a few. So nurse specialists play a vital role in the person's cancer journey, so we need to be making sure one is looking after them. We need mind shifting and coordinated work to be done in different levels and different stakeholders in order to achieve this. Firstly, it is important for the European Parliament to take action on prostate cancer and work with the Commission and member states on strengthening the care of prostate cancer across the cancer continuum. The upcoming Europe's Beating Cancer Plan and all national cancer plans need to promote this multidisciplinary approach to caring of people with prostate cancer, which is an effective pathway that can provide an appropriate correspondence to their specific needs. From our professional societies perspective, such as the European Oncology Nursing Society, we need to work towards building the capacity of the nurse specialists, working in the field, and also to prepare the appropriate lifelong courses that correspond to the specific needs of people with prostate cancer as this change over the cancer continuum. The EU for Health program provides an excellent opportunity for such educational programs to attract financial support and above all to attain sustainability over time. Thank you.
Thank you very much, Andreas, setting out for us the importance of having qualified and trained specialist nurses to be at the side of patients as they go through this experience. Jacqueline, let me turn to you and invite you to share from a patient's perspective, and particularly you might want to pick up on some of the issues around stigma that affect people with cancer.
Thanks, Tasman, and hello, everybody. Well, I'm the wife of a prostate cancer patient, as well as being the secretary to the board of ECPC, and I'm also the director of services of a support centre here in Galway in Ireland. There was a lot of information when my husband Mike was diagnosed that we weren't given. And one very simple thing was, if Mike had done pelvic floor exercises before his surgery, there was a good chance that he would actually gain his continence back a lot faster than he did. And we have seen the results of that since, where we encourage men here who come through our centre always to go for pelvic floor exercises beforehand. So you're actually going in for your surgery match fit as it was. The stigma associated with treatment of prostate cancer is multifaceted. The side effects of all prostate cancer treatment, such as sexual dysfunction, loss of libido, incontinence, affect patients and their families on a daily basis, causing emotional distress, guilt, isolation, and anxiety. Many of the patients feel uncomfortable talking about the condition with close friends, family, and healthcare professionals, let alone becoming the face of awareness campaigns targeting the general public. In fact, a lot of healthcare professionals are uncomfortable to talk about sexual dysfunction, and quite often will never broach the subject. To tackle the stigma associated with prostate cancer, a culture of openness about the side effects and treatment should be promoted through national and EU level. We need campaigns and education programs at all levels, supported by policymakers to educate the public and medics about the side effects of prostate cancer treatment, and to normalize the conversation around difficult topics such as sexual dysfunction, loss of libido, and urinary incontinence. Thank you.
Thank you very much, Jacqueline, for describing some of the realities faced by patients, the stigma and the taboos that are there, as well as that there are things patients could do if they're given information at the right time that have a huge impact on their quality of life. So thank you for that. Let me now turn to André Deschamps from Europa Uomo. What would you like to share? André, you're on mute. And if you could put your camera back on, please.
Okay, sorry for that. Well, what I like to share is that only 48% of men are aware of prostate cancer. That's a small study that we did amongst the patient community and the people last year. And PSA testing is not supported, or even worse, discouraged by 50% of all healthcare systems in Europe. And this leads to prostate cancer being detected in a metastatic phase, as I already told you, causing additionally side effects and further impact the patient quality of life. This all adds to the big stigma around prostate cancer that is still there. And because most of the prostate cancer treatments are affecting sexual ability and incontinence, it makes many patients feel very uncomfortable talking about their conditions, which in turn affects access to support and treatment, as well as preventing the dialogue and the awareness about the condition. Prostate cancer, together with the side effects of the current therapies, will impair the social and professional functioning of those living with the disease, affecting not only their personal life and also their partner's life, but also their ability to stay in the workforce. And to help to tackle the stigma associated with prostate cancer, the importance of awareness campaigns and early detection screening should be promoted at national and at EU level. We patients, we call for campaigns and educational programs at all levels, please supported by our policymakers to educate individuals about their risk, prevention methods and treatments. Thank you.
Thank you very much, André. Let me now pass to Maria Deschamps from the Charity Hospital in Berlin. Can you give us some insight into where you think we could have impact on improving prostate cancer treatment and care? Maria.
Yes, hello. Thank you for inviting me. I'm a medical oncologist, and I'm working in a very interdisciplinary setting here at the Charité in Berlin. I would like to share with you 3 points. So my first point is I want to assure you that we have made substantial progress in the treatment of advanced prostate cancer. And this is important, but in order to bring that progress to the patients, we need to find good means of distribution of that knowledge. And I think that we should use IT-based networks of physicians and patients. And this is key to bring all that we know and all the new treatments to those who are affected by that cancer. And in addition, we have our European guidelines, and an important way is to secure the standard of treatment by adherence to the European guidelines. I think this is also important. And the European guidelines are an interdisciplinary board, and I'm a member of the board, so we are working all together, and this is also something that Andreas has mentioned in his speech already. So being in interdisciplinary settings, I think, is very important. My second point is on age. So age is a key factor, and patients actually should be treated not according to their birth date, but according to their health status. And this is a very important point that we also mention in our guidelines and want to distribute. Treatments can be tolerated and can work also in older patients. The physiologic age is important, but not the birth date. And my third point is about the healthcare system. So health services are not always organized in a way which is designed to manage the increasing health needs of prostate cancer patients, and do not always provide that interdisciplinary way of treating and thinking of prostate cancer. So we should not waste resources, and we should not delay treatments in finding the right pathways. So working on the right pathways and avoiding delays, I think, is something we should focus on, and which is very important for our patients. Thank you so much.
Thank you very much, Maria. And I noted your point that we need to look at people as human beings and not just look at their age, but understand their risk factors and their health status as a means of being able to intervene earlier. And also that we need a sort of interdisciplinary group of professionals to create proper pathways for the patients. Let me now turn to Ortwin Schulte, the health attaché from the German representation. You know, Germany is a country that has invested a lot in digital and moving things forward, and that's what some of the colleagues have been calling for. How do you feel the EU could support member states in their efforts to improve treatment and care of patients, particularly those with advanced prostate cancer? Ortwin.
Thank you very much, Tamsin, and thank you for filling all this knowledge gap, especially in my personal case. It has filled some of these gaps, and taking it from the German presidency perspective, you know, the German presidency of the Council of the EU will still last some 21 days, and of course, this whole presidency went a bit different compared to plannings, which is mainly due to COVID-19. And we have some surprising circumstances, like Council Working Party Health being the Council Working Party which met most often under German presidency, which was quite an unlikely prognosis early in 2020. But of course, it has to be said, we had very much to concentrate on the immediate crisis reaction and coordination, as well as on the whole issue of the vaccine contracting. So some of the plans and postponement of the Beating Cancer plan of the European Commission has also been a consequence of this crisis impact. And certainly the impact of COVID-19, as has already been mentioned, on cancer treatment has also been noted, and this is an integral part of the Council conclusions, which are this week being approved by all 27 member states on lessons learned from COVID-19. Andreas already referred to the EU for Health program, and I directly come to this conference from the EU for Health trilogue between European Commission, Council presidency, and the EP. And indeed, very much thanks to an initiative from the European Parliament, which devoted quite a considerable extra budget of all in all 5 billion euros for 7 years to EU for Health. We have, I would say, a new dimension of possible health cooperation, and the budget will be 11-fold compared to the 7 years period 2014 to 2020. And of course, as it does not come as a big surprise that all institutions are in favor of covering cancer in a way which is according to the political importance which is attached to that. However, it is important to note EU for Health will not generally ring-fence any project. So it is, like it was before, a competition-based model. And I think, and this is something I often discuss with medical societies and the medical civil society, that now time has come to develop something. We will, as we have the 9th of December and the 1st of January is quite close, we will have a little bit of a belated start with the program, but I think work on possible projects should start now. And I've heard a lot of initiatives coming, and there's a lot of discussion on that. We have some traditional instruments like the cooperation in joint actions. We have European reference networks, a possible work on quality standards, taking into account the national health system policies, though there's a lot to be done, and we are looking forward to that. And I'm quite certain from the close coordination with our esteemed trio partners, Portugal and Slovenia, that especially regarding cancer, this method will be taking through the whole 18 months. Thank you very much.
Thank you very much, Ortwin. And it's very interesting to have the news hot off the press, as you say, from the trialogue, and to see that, health has received, 11-fold increase in budget and political focus in the past 12 months. And let's hope that that carries forward, because health has become now central to our approach to what the EU is and what it does. Let me now bring in Jan-Willem van der Loo from DG RTD, the Research Department of the European Commission, to share a little bit, where the EU can be seed funding and supporting efforts to improve outcomes and generate research. Jan-Willem.
Yes, good afternoon, so honourable Member of Parliament and speakers and guests. So just very briefly, I was asked to say something about the efforts in preparing the mission on cancer. So We know that prostate cancer is a big issue, is a big problem, has been like this for many years. Unfortunately, we know that from the, let's say, all the efforts that have been undertaken by many stakeholders and also by, research funding by the Commission and by also actions, health actions by Santé. We noticed that despite a lot of success, this is not enough. We know that incidence is increasing. You have already mentioned a number of important issues. So the Commission has set up a number of missions in a preparatory phase. I would like to underline this. So we are working on preparing these missions, and for the moment there are 5 that are moving forward. But all these 5 will see a feasibility check somewhere around the summer of 2021. A feasibility check on their implementation plans, which we have started working on, to see how and when all these missions will then fully start. So in terms of prostate cancer and cancer, let's say in the mission, the previous speaker already alluded to this. So the health attaché is that indeed we are working very closely with our colleagues in DG Santé on the cancer plan. So we are working with them on the mission and the cancer plan. So let's say it's important to understand that both initiatives are closely linked. So the cancer plan, as you know, is a von der Leyen Commission key flagship. So it's a key Commission priority, and all services that are involved are closely working to make this a success. And as you heard, the adoption of the cancer plan has been delayed until probably end of January. And the mission comes in with a, let's say, it will bring in the key research and innovation actions that will be later developed under the cancer plan and by the mission. And that's where we are at the moment. So the mission board has prepared a number of mission actions. And these mission actions are being discussed, are still being finalized, fine-tuned. It's not so easy because we also, and you may have seen that, may have heard that, may have read this, the board and the Commission, we have engaged with citizens, including patients, but not only, in different languages in different countries across Europe to see what they think is relevant for cancer. And so the idea would be that knowing that the incidence it will probably increase by about 22 to 25% by 2035. More needs to be done, and that's why the cancer plan and the mission together are hopefully going to address this in a successful way. And I think I can say much more, but I would like to stop here.
Okay, thank you very much. You've given us lots of issues that I'm going to pick up on and come back to, and I'm sure we will have input from our audience. I'd also like to bring in at this point, we have 2 other members of the prostate cancer expert group who'd like to share some perspectives. So let me invite Philip Reynolds to unmute and to put on your microphone. And then we're going to go to Mary Rogan. So let's start with Philip.
Hi there, thank you for allowing me to join in. First of all, I just want to say, we can see just by what's happening today, how big an issue this is. The fact that we have this meeting and all the people that have joined virtually is just amazing. So we can see that it's an issue. I just really want to highlight that, I mean, the words that my colleagues have already said, and just reiterate that this is a huge problem. We've already said there's over 2 million people living with prostate cancer across the EU. And it's very much a multidisciplinary issue. There are more treatments and people are living longer with prostate cancer and living with the consequences of treatment. So it's very important that we do try to catch these things earlier, make them, when they're caught earlier, they're eminently more treatable, and we can deal with the consequences of earlier treatment a bit better. We are a bit more educated nowadays. Things like, erectile dysfunction, incontinence are dealt with better, I believe, than they were years ago in some capacity. There's still a lot more that we can do. But COVID has highlighted the fact that there's much more that needs to be done, around, certainly in England, referrals of urological cancers dropped around 50% at one point. So we're going to catch these patients at some points with more advanced prostate cancers, and these people are the ones we need to treat and learn how to deal with the consequences of living with and beyond prostate cancer. Thank you.
Thank you very much. Mary, let me bring you in now. What would you like to share?
Okay, thank you, Tamsin. As a GP working at the front line and also having a special interest in sexual dysfunction, I see a good many men with prostate cancer. And access to information, as mentioned by many of the speakers earlier, many of the very able speakers, I must say, is very important. And another speaker mentioned multidisciplinary teams, and we certainly need multidisciplinary teams because psychological support as well as medical care and social support are all needed. However, we don't need to wait until we have multidisciplinary teams and specialists trained up. We can start now. Our nurses, our doctors, our junior doctors, our physios working in the area of prostate cancer and urology in general have the information. And what they need to do is give permission to the patient to speak about any difficulties they have. So they need to give the information as to the twin scourges of incontinence and erectile dysfunction, and they need to allow the patient to share any difficulties they have. This should take place on their first visit to the clinic, even before they have any intervention for prostate cancer. And remember, it's not the prostate cancer that causes the problem so much as the intervention. So patients need to be informed. But sometimes at an initial session where someone is told they have cancer, and then they speak about the intervention and the side effects of the intervention, you've lost them at the cancer diagnosis part because the rest is TMI. It's such a huge thing to be told you have cancer. So we're using our existing resources. I think we can do an awful lot, but we need to break the stigma that Jackie mentioned of healthcare providers not speaking to the patient about the area of sexuality in particular. We also need a standardized formal way of dealing with prehabilitation in the sexual sense and rehabilitation, and this needs to be standardized throughout Europe. I think this is really important. And the other thing, if you're looking at it from a biopsychosocial perspective, the social perspective, it's particularly evident here in Ireland, where we have a two-tier medical system, private and public, running side by side. And people in the private system who go and see a private urologist and have their intervention in a private hospital don't have access to the aids that are really important, like incontinence aids, like vacuum pumps and other aids which are available in the public system. And sometimes they are unable to access advice as well because they're in the private system. So we need to make equal access, I think, a very, very important part of our aspirations in dealing with prostate cancer. And finally, again, working as a GP, the only test we have, it was mentioned by many of the speakers that prostate cancer is symptomless until it has metastasized. And we really don't want to be dealing with advanced prostate cancer because it's such a terrible experience for patients. And there is no hope really at that stage. We need to be able to be catching it much, much earlier. And I think it's important to stress to all my GP colleagues, both in Ireland and throughout Europe and the UK, that the PSA test is a very adequate test and accurate test at the moment for diagnosing prostate cancer. So we should be screening, and there should be, again, a formalized tool or method. Doctors should be able to look up and say, find out that you start prostate cancer screening with the PSA, let's say at the age of 40. There isn't anything like that at the moment, so it all depends on the latest study. And at the moment, I think we're being told that the PSA isn't necessarily the thing to be doing. and we shouldn't be screening too young. So we need guidelines, and the guidelines are very, very important also.
Excellent, thank you very much, and it's extremely helpful to have your input, illuminated with the stories of your everyday practice, dealing with patients every day. So thank you to all the members of our panel, and we're now going to have a conversation, and you can start putting your questions and comments into the chat because we will be dealing with them. And I have a couple of inputs already, let's pick up a little bit, I think, on this issue of awareness, because every single speaker has talked in one way or another about the fact that public awareness is low. And because public awareness is low, people who are at risk and those communities at higher risk are not presenting to general practice. They're not therefore engaged actively in screening, and we're not being able to, it's symptomless, we're not catching people early enough. So, how do we address this issue of public awareness? And I'm going to pass this question over to Ortwin, because I think it's an important question about, where is the responsibility between member states and the European Union? Because this issue, should we have these big publicly funded awareness campaigns? Some countries do them. For example, the UK does that on colon cancer and breast cancer. We can see that the map across Europe that it's very unequal about the way that we do it. Should, as part of our approach to cancer, and we've declared war on cancer in this mandate, should we be trying to have pan-European information and awareness raising campaigns? Because this is an issue that is so ubiquitous to half the population of Europe. Ortwin, what do you think?
Thank you very much. This is a very delicate question, which also has been discussed in the course of the trilogue. And of course, a program, as I said, which has an 11-fold budget, could also reach a new dimension regarding the range of possible projects. On the other hand, and this is especially important for me as being, as presidency, as a representative of the council at the moment, there is a reluctance to go into direct public health related action on the European level. And one of the magical words in that is to support, not to do a campaign, but to support a campaign and to deliver via best practice exchange and via scientific dialogue, and also via direct dialogue of health prevention and promotion, a toolbox for member states to act. I just would in that context like to refer, and German permanent representation even did a big conference in 2018 together with the German Medical Self-Administration here in Brussels, that the issue of quality standards for medical care is one of the most contentious questions in that regard. And of course we know and we appreciate that there are networkings regarding quality standards by medical civil society. But if that should be a state-driven EU 27 exercise, then I would expect, to put it in cautious words, a certain degree of resistance from member states due to the variety of health systems, and also due to the different traditions which health systems have. On the other hand, you could also say, and this is a little bit of a look in the future, that of course COVID-19 crisis has been something like a very clear demonstration of the possible effects and prospects of European cooperation, and how this might alter the overall landscape is a question on how to shape the future of European health policy. But I'm obliged as a council to just introduce some degree of cautiousness here. Thank you.
Thank you. And I think it's a fair point to say, where is the best level to do this? And as you say, I mean, we have more money than before, but that pales into comparison to the kind of money you would perhaps need to run a huge pan-European awareness campaign. So there's an element of reality that's in there. We've got a question now from the audience, which is talking about something called a dashboard. And the idea here is that we've got this big political focus on the Beating Cancer Plan. You've got a mission board. You're talking about a moonshot to address cancer. Should we have some kind of dashboard that's public, that's easily accessible, where we could measure the progress towards these goals? And obviously in areas like prostate cancer, we could be more specific around, for example, the proportion of population that is getting screened, the number of people who are diagnosed at an earlier rate, long-term survival levels. So there are, for each different part of cancer, some elements that could be put into it, but then that allows everyone, all stakeholders, to see how are we doing around these political goals. Members of the panel, this was a question we've come in from the audience. Does it make sense to have this kind of dashboard? And the logic of that is, what gets measured gets done. So to translate these nice words into action, we need a measurement tool that everyone agrees on. And I think I might come to you, Jan-Willem, first from the point of view of the Commission, and then I'll ask the other stakeholders. Is the dashboard going to be the element that guarantees that we get action out of all these big plans? Jan-Willem.
Yes, thank you for the question. This dashboard has been around for quite some time. We are aware of this. Let's say we have to see. We are not so sure that it will be so very important, but I think it remains to be seen. And I think, as you refer to the cancer plan, I think it needs to be discussed within and with Santé to see if this is really something that would be so very important, because output is not only based on quantitative indicators, but also qualitative results. And so I'm not so sure that this is so very important, but nevertheless, it's an interesting question. So I do not have an answer at the moment.
Okay, thank you. Who else from the members of the panel is interested in picking up on this issue about whether a sort of standardized dashboard would help us understand how we're all doing to these big processes around cancer? Any member of the panel? Yes, André and Mary, I see your hands up. André, go ahead.
Well, the question is, what do you measure? I mean, if you now, as I said before, that 50% of our healthcare systems in Europe are not supporting any awareness campaigns or early detection campaigns for prostate cancer. If there is no pressure from above, from the union to do that, they will never change. So measuring is one thing, but what do you measure, and how are you measuring that it is effective? For patients, that's very important. Thank you.
Thank you. Mary, would you like to come in on this?
Yeah, it's quite a broad term, dashboard, well, in my feeble mind anyway. So I just wonder, are you looking at inviting feedback from patients, or are you looking at inviting opinions from patients? Because I often say when I speak to groups of prostate cancer sufferers that they should lobby government for equal access to the medical aids I mentioned earlier, and to psychological support, etc. And like, it's all about the voter at the end of the day. So, I mean, if our voters are putting pressure and requesting and demanding better treatment, then I think that's a very positive thing.
Thank you. Who else would like to come in on this? Andreas, would you like to? Yes, go ahead.
Yeah, I already responded something on the Q&A section, but as an idea, the dashboard, I find it very interesting. And I do think that if we take into consideration some of the limitations that Mary and Andre already pointed out, we can shape the dashboard in a way that it truly corresponds to what we need to measure, and how we plan to use those information. And above all, a dashboard needs also to be taken into consideration the realities of the healthcare systems across member states, and not just be a rigid tool that adopts the idea one fits for all, which will not be appropriate in this case. But unless we measure something, and this was one of the attendees' comment, unless we don't measure something, we don't know if there is something wrong with it, and therefore we cannot change anything about it or for it. Thank you.
Thank you. Perhaps let's move on now to this issue that's come up a little bit in the Q&A, and I encourage you, audience, please feel free to put in your questions and your comments in the Q&A, because we're looking at it now. Something's been picked up, and I'm going to come to you, Maria, is this issue of interdisciplinary care and the quality of standards. You've mentioned, Maria, that you work in an interdisciplinary way. Andreas has also highlighted, is this the gold standard? Do we see this being offered across Europe? Because if the vast majority of people who are getting diagnosed are diagnosed at a late stage, the range of options for treatments is obviously therefore going to be more limited. And do we have agreed guidelines on quality of care that would include surrounding the patient with an interdisciplinary team that could deal with physical, psychosocial, emotional, and other areas of well-being? Maria, are you an outlier, or is this what you see across Europe?
Well, I'm not sure if this is the case across whole Europe, but I think it is more and more coming into the minds of people, and it is something that is actually written down in not only the European guidelines, but also more and more national guidelines, that patients also with advanced disease, or let's say in particular with advanced disease, should be seen in multidisciplinary teams. And this is standard and should be standard, so that radiation oncologists and urologists and medical oncologists, pathologists all work together and then provide the best possible care and options for that very patient in an individual situation. This is something that takes time and also needs funding. The funding is sometimes the problem. Many of my colleagues, my international colleagues, tell me that they don't have the time and don't have it as part of the work plans to do the MDTs that take hours in a week. It is not something that you do in a few minutes. I used to work in the UK, where this is well established, and it is also established in Germany and in other countries, but also quality and funding of those tools and those important team meetings is very important. And I think this could be done in a better way throughout. It is not in all places done in the best way, I think.
Thank you. Andre, you mentioned earlier that there is a digital interactive tool. Does this track things like the extent to which the treatment is provided by a multidisciplinary team and that you have this kind of broad support? What's covered in this interactive digital tool that you mentioned, Andre?
Are you asking me that? Great.
Yes.
Well, we measured with UPROMS the quality of life of patients throughout Europe, and 3,000 patients answered, which is more than 1 in 1,000 patients. And you see that there is a very big difference in cancer care all over Europe. And if we are talking about multidisciplinary teams, yeah, we see it happening, and Maria is quite right. We see it happening in a couple of countries. Unfortunately, we see it not happening all over Europe, and that I think that's because it is not measured. There's no pressure that it is the best standard care. And I know that the EAU and others, I mean, the guidelines are there, but it is not happening. And it isn't happening because the means are not there, or not all hospitals have enough people to do it. But we support multidisciplinary teams very much. And I even think that no patient should be treated without a team.
Thank you. Jacqueline, I think you wanted to come in on this issue.
Yes, I honestly believe we have to pare it right back. We're the whole time, rightly so, empowering women to have their voice heard when it comes to breast cancer. and their campaigns are very, very effective. We now need to give men, and in particular young men, so we need to start back at schools, and as mothers, and as a mother of a son, I need to give my son a voice that his health is important as anybody else's. And we need to start educating right back at school, where boys are actually taught to look after their own health. And this has to be done right across the board. And I think it goes right back to there. You know, when a man gets sick, we tend to dismiss him, and he's called, oh God, you know, it really is dismissed. And then we expect them to turn around and talk to us. So we have to start with teenagers and give young men a voice to be heard, and it has to be respected.
Thank you. I'd like to pick up perhaps on this element again to talk about what's the relationship between what we can do at European level and what's best done at other levels. And I'm going to come back to you, Ortwin, because fully understanding that member states manage their health systems, but you know, how do we leverage the capacity at the EU to help disseminate? We've talked about good practice, we've talked about guidelines, and guidelines exist, but they're not equally applied. We're still not getting the same levels of care, or you know, more pioneering versions of interdisciplinary care, etc., elsewhere. So what do you think is the right mechanism at EU level that is going to respect the sovereignty of member states? So we're not going to try and you know, remote control health systems from Brussels, but the guidelines are there, the gold standards are there, but we've got unequal implementation, which, as experienced by patients, and that's what some of our participants have spoken about, the experience is unequal. So how do we manage that delicate balance? Ortwin.
Yeah, thank you very much for this complicated question. And as I said, health policy is certainly one of the areas where national sensitivities are highest. And this has, I would say, two reasons. First one is that in many member states, healthcare system is very deeply enshrined, or in the German case, also mainly governed by the medical self-administration, which has a clear view on a national decision-making on the most important points. And the second reason, obviously, is that health policy is potentially quite an expensive area of policy, and that this is also relating to some general questions we are discussing on the European budget. But indeed, we now have a very high degree of likelihood that a very much reinforced budget will come into reality. And I would say that the field of cancer, as well as the field of communicable diseases, is likely to be one of the pilot areas where we will see looming structures of future European health cooperation. And in the communicable diseases field, the European Commission last month tabled a very comprehensive package on the future structure, including one network on serious health threats, a very much increased mandate of the ECDC in Stockholm, and an increased mandate of the European medical agencies, which will be, and we started already negotiations on that in the Council, of course be subject to a discussion, and it's no surprise if 27 member states are intervening. There are different interests, and there might also be a certain form of cautiousness from some member states on that. And we will see that. And I think that the EU for Health program has a potential to be to take over something like a pilot function, also as a room for experimentation on that one, and for moving on step by step. But I would say also we have this very direct impact of COVID-19 on everyday life and throughout the EU, that it will not be, how should I say, it's a natural consequence that we will have a very much more harmonized health system in the EU. Let me put it that way. Thank you.
Thank you. And I quite understand that this is a challenging issue, and I've worked on health policy at EU level since 2002, and I remember being part of the NGO groups back then who was campaigning to put health higher in the Convention on the Future of Europe back then. So I know that this is not a new topic, and that COVID has concentrated everyone's minds on this issue. But my experience as well, and I'm sure some of our other panelists will share it, is if you talk to patients or clinicians like Mary on the front line, they don't really care whether it's an issue of subsidiarity or not. They really want to know what Europe, as a sort of an idea, can do to improve health outcomes. And if there is an idea that there is a better quality of standard of care that's being offered in other parts of Europe, they want it brought to their country and into their practice and for them now. And, you know, in Brussels, we tend to do a lot of arguing around competence and who does what. But the reality of the people who are involved in the system is they want it to work. And that what they want Europe to do is to deliver that working. And however we come up with a solution, whether it's a dashboard or more enforceable guidelines, you know, more powers at EU level or not, I think what the experience of patients, and I saw Mary, you were nodding there, is they just want it to work. Yeah. And they want to have this, you know, leveling up to the best standard rather than this patchwork of saying it depends where you live, what you get access to. And we understand that there's implications on cost and everything else, but the people in the system really want it to work. So who wants to pick up on this? What you think we could reasonably expect the EU to do to create this momentum to improve care? Andre, yes, go ahead.
Yeah. I just give you one simple example. When I spoke to the Belgian health authorities in order to change their vision on early detection, the simple answer was, even Europe has not put it in their cancer plan. Well, that explains it. The first thing Europe can do is, just like they do for colon cancer and breast cancer and other cancers, to add it to their cancer plan, so that at least the member states knows that it is important and it is supported by Europe.
Okay. Thank you. We've had a couple of points that have come in through the chat. Robert Green has asked the question, should we also start using men who are not diagnosed with PCA to help create awareness, because they could be perfect in disseminating knowledge on personal screening? So, you know, how do we involve men who have a role to play? And I think, you know, Mary, you talked about empowering men, and Jacqueline. We've had a question from Martina about in Austria, where the Austrian Cancer Aid runs an awareness campaign together with the urologists. And they've seen that they need, you know, you need a broad brace across the healthcare system in order to bring men in for early detection. And there's a big difference between knowledge and actually then using it to implement it and doing something about it, and saying that we need to have much better awareness, just in the same way that 20 or 30 years ago, the breast cancer community was very good at raising awareness. Where is the energy coming from to raise awareness around prostate cancer and to get men talking more about this? Who would like to pick up on a couple of those points? Andre, yes, go ahead. So Andreas, sorry.
Thanks, Tamsin. I think it was already mentioned by several of the previous speakers, at least getting men talking about this, it very much relates to the fact that prostate cancer is still being considered or being dealt with as a taboo topic, and it is associated in some countries, I don't want to say many countries, associated with stigma. And this is something that puts off people from engaging in such discussions. It also, and this is evident in research as well that this stigma can also prevent men to attend to screening and not only talking about the disease once they are being diagnosed. And I think that awareness campaigns needs to start by breaking down the stigmas and allowing people to express themselves as openly as possible. Thank you.
Thank you. Phil, you wanted to come in on this?
Yeah, I think it's, as everyone said, it's important to highlight this, but just jumping on what Jacqueline's already pointed to, getting wives and partners also involved in this is incredibly important, because just a kick up the backside is sometimes all people need, a little push, but it is, yeah, it's a huge issue which needs education across the board, general public, general practice, hospitals. Everybody needs to highlight what an issue this is.
Thank you. Maria, do you want to come in on this with your experience from your practice? And I'm interested in, looking at this issue around taboos. To what extent do the patients who come in to see you, are they alone? Are they supported by their families? Do they feel very lost? Is, the taboo and stigma an issue you're seeing when you deal with patients?
Well, I think it is very true that the partners, wives, families play a very important role, and most of my patients who live with their families and in a partnership actually see me with their partners and also with family members. Now with COVID-19, there are some restrictions, but in general, I think this is extremely important. And also to make the whole family aware of issues, aware of side effects of certain treatments, etc. So we usually talk all these issues together. So yes, involving the family is important. But I actually wanted to come back to the educational part, if I may. So I not only treat prostate cancer, but also testis cancer. And I think it could be a great idea to institutionalize that part, healthcare in boys at school. And I think there's a gender gap. Girls are much more aware of their body and of health than boys, and educating them about testis cancer in the first place, and then that there is something like prostate cancer early on in the young adults. I think this is important and could work together, and this could be an investment into the future of those men. I've been working in the testis cancer field for some time, and we have had awareness campaigns in our schools when I was back in Austria at the times, for example, and that might be a way to improve knowledge and invest in to the future of our boys and men.
Thank you. And I think you're right, because there is this window of time. There's a window of opportunity for children age 11 plus, when they start being offered the HPV vaccine, which is largely offered to girls, but increasingly countries are starting to offer that to boys. There is a window of time for a conversation there about future sexual and reproductive health as well as cancer risk. So I think you've raised the point. There is an interesting window that we can pick up on. I see, Jacqueline, you'd like to come in, and I would also like to highlight, we had another question from the audience that's worth picking up, which is, and I think it was André, you mentioned that Black and ethnic minorities are at higher risk of prostate cancer, and it would be great to try and understand, is it a biological basis? What is the reason, or is it general inequalities? So Jacqueline, after you say something, I'd like to explore this issue of inequalities. Jacqueline.
Thank you. When I got my period, it was something to be celebrated, and I think for young girls it is. They're just coming into womanhood, and it's a wonderful thing. We need to do the same thing for boys when they hit puberty. We need to allow them to celebrate the fact that they're turning into young men, and with that comes the responsibility of looking after their health. And again, it starts at an early age.
Thank you for that, Jackie. Let me ask members of the panel, do we have an explanation as to this difference in risk factors for different members of the community? Do we know what the basis of that is, what's it's linked to, and if we need to do, different outreach, if we need different treatment models, what's the basis of that? Can anyone answer that? Andre, you brought it up. Yes, let me ask you to answer.
The only thing that I can bring to the part here is facts. I mean, if you look at the northern side of Europe, prostate cancer, the prevalence is, the incidence is much higher there. It's less in the south, and it's very similar for Black men. And also recently, it is now in that BRCA 1 and 2. And if you have in a family BRCA 1 and 2, it's not only affecting women for breast cancer, but also men for prostate cancer. That's the only thing that I can say. What the real reason is, I do not think, as far as I'm aware, that there is a real answer to that question. It is just a fact.
Thank you. Phil, is there anything you can help us to understand the issue of inequalities?
So, well, as Andre said, there's no real evidence for the reason that Black men seem to get prostate cancer, more aggressive prostate cancer. The only thinking that there is that Black men may have higher levels of testosterone compared to other men, which may be a factor, but not a cause. And we know that people, let's say in Japan, who emigrate across to the States, while the incidence is low in Japan, when they move to America, the incidence increases. So there's obviously environmental, dietary, and other factors that can be taken into account as well. But for the increased incidence in the BAME society, the BAME people, no, there's not. It's not really understood.
Okay, so that's clearly an area where we need to understand more about the epidemiology of the disease, who's affected by it, what the risk factors are, things that would be both protective and increase the risk. So it looks to me like we have a lot of different issues that need to be addressed, but as a minimum, it's clear that there are gaps here. Mary, come in, please.
Yeah, I just wanted to say on the previous point, disseminating the information, I think it's important to think of social media. I'm on the communications committee of the International Society of Sexual Medicine, and we put out a social media tweet or Instagram or Facebook, whatever, every day. And we could use social media to, I think, probably normalize the fact that there is such thing as prostate cancer and that men need to look out for it.
Okay, so using the social media and other outreach, we need to sort of not wait until people turn up in their GP's room and then give them awareness, but we need to get a broader dialogue in society and using all the tools that are open to us, including social media. If we need to be addressing men at a younger age, then clearly we need to be using the channels, communication channels where they're present. I'm looking at the time now. We've probably got just another few minutes on this panel. Closing messages that everyone would like to say. What do you, if we are having this panel again in, say, 5 years' time, what do you hope we're talking about? What kind of progress do you hope we would be able to report? Final messages from the panel. Andreas, shall I start with you? What would you like to leave us with?
Well, what I like to see happening is that every man is aware that he has a prostate and he needs to look after it.
That's short and sweet. Okay, Mary, what would you like us to be saying 5 years from now that we've achieved?
I couldn't do better than Andre, and that we would have a good information campaign and that there would be no stigma around prostate cancer.
Okay, so everyone would know that all men would know that there is such a thing as a prostate and they have it, and there'd be no stigma about talking about it and addressing it. And if there's a problem with it, being able to get it addressed.
Yes.
Phil, you're nodding. What else would you like us to have achieved in the next 5 years?
Yeah, I'm just really nodding in agreement with what's already been said. I think in 5 years' time, it'd be nice to not be talking about prostate cancer at all. But I don't think time will tell. But just agreeing with what's already been said so far.
Excellent, thank you. Jan Willem, what do you hope in 5 years we are no longer talking about? What do you think we might have been able to achieve?
Yes, thank you. So I think cancer will not go away, and neither will prostate cancer. But I think hopefully in 5 years, so well, the mission and the cancer plan are well underway. I really hope that together with member states and many stakeholders and citizens, patients, that we can show that indeed cancer care has improved for men with prostate cancer.
Great, thank
and
you.
The more treatments are really being made available. But and you mentioned inequities. This is a very important part of the cancer plan and the mission. So the treatments are made available across Europe, and also, you know, as we've heard, also early diagnosis. And let's not open the Pandora box of screening, but these are all important issues that I really hope in 5 or 7 years we have seen some progress by then.
Great. Ortwin, what do you hope in 5 years we've moved to achieve?
Well, the normal MFF period is 7 years, but in 5 years we can take stock, and I would indeed hope that then with Horizon and EU for Health, we will have identified some added value projects, which is then implemented at the national level and is not felt as a threat to the national level. Thank you very much.
Yes, exactly. Maria, what do you hope we will have achieved?
Well, I would wish that every single man with advanced prostate cancer is going to have a discussion in an MDT board before treatment.
Okay, thank you. Andreas, what do you hope we could have achieved?
Well, I will comment on my opening speech, and like Maria already said, that in 5 years we hope to see that more of these multidisciplinary clinics and are embraced more and more across member states, and at the same time the professional societies will do their best to increase the capacity of their working force in order to correspond to the needs of people affected by cancer. And I'm stating here people because it's not just the patients.
Thank you. Jackie.
Yeah, I'd agree with what everybody has said, but I really believe that information is power and knowledge is no good until we share it.
Okay. Thank you. Well, I'd like to thank all of our panelists for their interventions and their insight. I think we had a really good exchange about where the gaps are and what we could be, the multiple places and areas that we could be making progress together across Europe. So within 5 years, we could have a different conversation because we've got improved outlook. So thank you to all the members of our panel, to Andreas, to Jackie, to Ortwin, to André, to Jan-Willem, to Mary, to Phil, and to Maria. Thank you very much for sharing your insight and your inputs. So just to sort of sum up, it's clear that at our most fundamental, we've got a gap of awareness and information. And to tackle that, we have to start young. That means starting with boys before they become men and through their life, so they're aware that they have a prostate, some of the issues that might go wrong, what the symptoms would be, and that they feel comfortable talking about it. It doesn't have to be an issue of stigma or taboo. We need to get to a point where the knowledge that we have right now is equally shared and implemented across Europe, that the kinds of interdisciplinary care that is available in some areas is available to all, and that patients are received with respect and dignity and given them and their families the kind of support that is available to a gold standard. We need to be investing more in our knowledge, so we've got a better range of treatments, we've got better, faster diagnostic tests. We need this to, prostate cancer to be highly visible in the cancer plan because of its specific burden on men. And we need as we move forward in the sort of post-pandemic world and try to find what is the new role and relationship between Europe with its ability to leverage and catalyze funds and momentum, and the work that member states do, because they're quite legitimately accountable to their citizens about delivery of service. How do we get that balance right? And particularly so that it's a leveling up rather than sort of countries hiding in their own corner, and that for patients and people working in health systems, they don't feel frustrated by getting this message that it's not at this level, not at that level, that we see real change happening. So I think we've had a really useful exchange in this panel, and I'd now like to hand over for the closing to Hendrik von Poppel, and he is from the European Association of Urology, and he's going to give us the closing remarks and to go tell us, where do we go from here? Hendrik.
Thank you, Tamsin, to allow me to conclude this great roundtable. My name is Hein van Poppel. I'm an oncologic urologist based in the Catholic University of Leuven in Belgium. I have been treating more than 10,000 patients with prostate cancer, and I've done around 3,000 radical prostatectomies in them. But today I'm here because I'm working in the EAU, the European Association of Urology, an organization with 18,000 members, where I am the Adjunct Secretary General for Education. And we do not only want to educate professionals, we want to educate patients. And I feel it's my duty to also educate policymakers and to educate our healthy male population. Now, I want to thank and to congratulate all the speakers that have been excellent. And I must say they have not only been excellent, but they were nice and very kind to these people that have responsibility in our healthcare, the political responsibility. The key point for me is awareness. Who knows what prostate cancer means today? It's the most common male cancer, it has been said. There is an increase from 2012 to 2018. It has not yet doubled, but about doubled. Can you imagine? And obviously today, COVID catches all the attention. It kills too many people. Sure, but COVID, we will beat it. We will one day beat it, maybe probably in 2021. But prostate cancer will go on and will every year continue to kill more than 100,000 men. And this will be in 21, 22, 23. And it will continue being so since we have not started an early detection program yet, and people will continue to die as they do today. Prostate cancer, 107,000 deaths in 2018, and only 92,000 in 2010. So why is this increase? It will continue to increase in the years to come, every year again. So there is absolutely something to do. Nevertheless, prostate cancer gets no attention, and it has been said by MEP Olekas before. In 2003, the Commission has had breast cancer, colorectal, and cervix screening allowed or endorsed in the European Union. The revision in 2021, will we have lung, pancreas, prostate? It's not sure yet. And advanced prostate cancer is very bad. It is mostly killing when it is detected too late. And secondly, and André Deschamps has emphasized very clearly, the quality of life of prostate cancer patients is poor. Why? Because of the treatment we give. The local treatments give them urinary problems, sexual problems, bowel problems. Hormonal treatment in too late diagnosed prostate cancer. They have sexual problems of castration. They have psychological problems, metabolic syndrome, flushes, obesity, diabetes. Multiple treatments will decrease the quality of life. And really the 2 last years of a prostate cancer patient is very poor. And then on top of that, they get terrible bone pains because of the nature of the metastatic status of prostate cancer. It's a terrible quality of life, impacting on fatigue, sleep, sexual function. And the politicians should not forget how costly this is. The treatment of hormone refractory prostate cancer to make a patient survive 2 years longer is 10-fold more expensive than the local treatment with radiotherapy or with radical prostatectomy. And more of that, importantly, advanced prostate cancer is increasing. We see it more and more because of the anti-screening lobby, the anti-PSA propaganda that we have had for years. And the second factor is COVID. In Belgium, I know today there is 15% less prostate cancer diagnosis. All these people will come with a too late diagnosis, and therefore Let's Start Prostate Cancer is focusing on this large group of patients that finally will die from the disease. Prostate cancer kills more than breast cancer kills women. It kills more than colorectal. In the UK and in the US, in the UK, there's a 17% increase of mortality by prostate cancer in the last 10 years. So let's talk about prostate cancer initiative. And thanks to Tiemo Wölken, our MEP, and Olekas, and to Sirpa Pietikainen, who couldn't make it today, but also the support from others like Véronique Trier-Lenoir, the Members Against Cancer, Christine Chaumien on the mission board. We need their support, and we hope we will get it. While I hear Willem van der Loo say it's all being studied, but we want to have action now. And Tamsin Rose, you asked, what do we need to achieve in 5 years from now? We will not decrease prostate cancer mortality. We will only see that if we have early detection in 15 years from now. So that's not the aim, but we need to improve the quality of life of the patients that have prostate cancer today. And this is more awareness. We need concrete policy action, awareness campaigns, maybe like Barbara Loughlin was just alluding to in the question and answer, maybe like they did for lung and for colorectal. We have launched the Interactive Digital Atlas. It's an impressive information. It's very comprehensive on prostate cancer in each other's country in the EU and also in the UK. There is a link to the digital atlas that will be shared to all the participants here. We need to have a call for increased political action. And Jan Willem van der Loo, I come back, give prostate cancer the place that it deserves. Raise awareness. The healthy population, as said by Robert Greene, we need to inform the healthy population, not the sick ones. And we need to improve care. Maria DeSantis, and thank you for your question, Tamsin, on guidelines. We have EAU guidelines, multidisciplinary guidelines. They are endorsed by the 28, the 27 plus 1 EU member states. They are endorsed by 30 non-EU states, including China, Australasia, New Zealand, India. So they are endorsed, but we need political endorsement, not only from the national societies of urologists. And then next to that, access to care, financing of care, which is a huge, important issue. The multidisciplinary teams, the guidelines, they are there. We need to have them implemented and endorsed by our politicians. And then last but not least, we need to decrease advanced prostate cancer incidence. And this can only be done. And Mary Rogan was very right. There's only one way, not population-based PSA screening, no. Early detection, risk stratified early detection in an informed patient. And this must be included in the Beat Cancer Plan. And we have to rely on the support of Tiemo Wölken, Olekas, all the MEPs, and also obviously from Willem van der Loo in the Commission. Thank you so much.
Thank you very much, Henrik, for a very passionate and very clear outline of both what we need to change and the kinds of timelines where we would expect change if we act, and what we can achieve in the next few years. So I'd like to say a warm thank you to everyone for participating. We've had a very high level of participation right through till the end of this session. And I'm going to bring this event to a close. Remember the hashtag Let's Talk About Prostate Cancer. In the chat, you'll find the links to the digital interactive map, so you can see what's happening in different countries and ideas for ways forward and actions that you can take. Thank you everyone for participating. Stay safe in these COVID times, and I'm sure you'll be engaged in another activity around prostate cancer in the near future. Thank you everyone, and goodbye.